A new study published in the Journal of Pediatrics finds that newly diagnosed cases of pediatric type 2 diabetes skyrocketed in the first year of the pandemic, increasing by 77% compared to the average in 2018 and 2019. Meanwhile, just yesterday, Dr. Anthony Fauci adamantly denied that pandemic-related lockdowns caused permanent damage to children kept out of school. Let's watch.
In fact, I think we need to make sure that your listeners understand I didn't shut down anything. There was a lot of consideration among the White House task force that we were reaching a point where the hospitals, such as in New York City and other places, were being strained to the point of practically being overwhelmed.
But in retrospect, Doctor, do you regret that it went too far? Whatever your original intentions were, and it's easy to be a Monday morning quarterback here, but that it went too far, that particularly for kids who couldn't go to school except remotely, that it's forever damaged them.
Well, I don't think it's forever irreparably damaged anyone, but I think obviously, and if you go back and people selectively, Neil, pull things out about me. I was also one of the people that said we've got to do everything we can to get the children back in school.
I think it's weird to say I don't think it permanently damaged anyone. I mean, there are cases of there are teenagers who committed suicide because they couldn't go back to school. You could say that you could make a different argument that it wasn't severe enough, and it was warranted because it was necessary to contain the pandemic. It was weird to me to say there was like no one who was permanently harmed by it. Certainly there were people who were permanently harmed by it. Maybe there were not enough of them to warrant doing a different policy, but.
Sure, I think that's semantically accurate. But this is from an article that's discussing the rise in type 2 diabetes. And they point out, quote, further studies are needed to determine whether this rise is limited to the United States and whether it will persist over time. This is from Dr. Kelsey. There's still a lot of work to be done. Whether the increase was caused by COVID-19 infection or just associated with environmental changes and stressors during the pandemic is unclear. And I think that's right. I think that there's a lot to be understood still about what's causing this effect. Is it that kids were not going to school and that school lunches were healthier than the lunches they were getting at home? Was it because of activity levels and just the number of steps that you walk per day is down significantly if you were someone who used to commute and walk to school? I know that was the case for myself. Those COVID-19 pounds, as they say, the COVID-19 habits just from not walking to and from work every day. I have to guess
that's the major factor. That even kids' athletics were held back. Extracurricular activities, even to some extent when schools were reopening or getting more serious about being in person, some of those things were delayed too. Kids, it's not healthy to have them. We were trying to fight screen addiction, right? And create a scenario where where their only way to socialize. Of course, young people want to talk to their friends. Everybody does, but young people especially want to see their friends and create an environment where staring at a screen in their bedroom is the only way you can see them.
I think that's all right. And Monday morning quarterbacking, is really easy and fun. The reality was that for the first year of the pandemic, there were no vaccines. Yeah. And people were dying. And as much as kids were dying at a lower rate, kids were in fact dying, including disproportionately Black and brown kids who were in the very groups that are now experiencing higher levels of diabetes. So when we're talking about permanent harms, I think we do have to keep that in mind as part of the conversation. So that's for the first year. And then after, not to mention the fact, by the way, that I think sometimes in the conversation about kids and their relative invulnerability to the worst effects of COVID, there's not a lot of conversation about the fact that they are vectors. They bring stuff home. And anybody with a small child knows that you get sick a lot as their parent because they're constantly bringing things home from school. And now you're talking about parents from disproportionately vulnerable populations, parents who might be disproportionately overweight and have these risk factors, which might not draw a lot of sympathy, but is also a risk factor to you if you're trying to keep yourself and your family safe. So I think there were a lot of bad decisions made, as I explained in my radar last week. But there was also, especially in that first year, I think I'm willing to give a little bit more latitude to the hard choices that were made by folks. I think that Fauci makes an okay point there about the fact that he wasn't the decision maker. It's curious to me that so much blame comes down on Fauci as a human being who's gonna be gone soon, as opposed to the Biden administration, which is very much still there, still making decisions, and I think absolutely should be held accountable for a lot of these choices. And I would love to have some people talk about how to get past this, like how to actually remedy this once we get through some of the blame game and the accountability, which I absolutely agree, there needs to be accountability. You know, what are we gonna do about all these kids? Type 2 diabetes is reversible. These are young kids. This is not type 1. Can we get them exercising again? Can we talk about the food problem in this country where we have so many subsidies of corn oil and simple sugars that are injected into all of our foods that make it a lot harder for Americans to stay healthy?
I never met a subsidy I didn't want to get rid of. So.
I love to hear that we agree on that one, Robby.
Fauci is right that when he says, narrowly right, when he says that, well, he didn't enforce these, he offered guidance. And the thing about it is the officials, the government officials, essentially outsourced the entire pandemic response to these public health advisors and just said, well, we're going to do whatever they say. Speaking of public health advisors, I wanted to mention Lyanna Nguyen, who is someone I've criticized. I criticized a lot because she was, she's on CNN. She's a doctor. She's the former head of Planned Parenthood, and she was this very pro-vaccine mandate, pro-mask mandate person. She, at one point, I wrote an article about her saying, she said something to the effect of like, well, you can choose not to get vaccinated, but then you shouldn't be able to choose to like go outside. Like she wanted to confine the unvaccinated to their homes. Was very serious about masking as well. Then she did really change her tune last winter, like it seemed kind of suddenly, and while still saying everyone should get vaccinated, and I think still supporting vaccine mandates. On the other, she was saying, no, we should reopen our schools and we should actually reopen them without mask mandates. So she just did a Twitter thread, and you can put this tweet up on screen. So this was a middle tweet of a long thing where she says, I accept the risk that my kids will probably, and so now she's saying this, and why she changed her mind. She now accepts the risk that her kids will probably contract COVID in school, just as they can contract the flu, RSV, and other contagious diseases. There is a trade-off. Masking has harmed our son's language development, and we do not wish to keep limiting our kids' social interactions.
The change of heart was about her seeing the effects of it on her kids.
She concedes that. So she says a couple things. She said Omicron changed her mind because from Omicron on, she said it was just no longer possible to, no matter how much mitigation we're doing, we were not going to do enough significant slowing of COVID for it to really matter. Everyone's going to get it. And she said she was willing to, for the good of society and for keeping everyone healthy, keep her, she has 2 young kids, kind of significantly interrupt their normal educational social schedule for like a year, 2 years, but then beyond that, she was seeing the harm to them. It was really hurting them, and so she wasn't willing to do it anymore. Yeah. So a lot of people are attacking her for saying, oh, now you get it because you and your family finally have experienced it. And I guess that's fair. I would always we should welcome people in once they've seen the light, so to speak.
Also, the idea that everyone knew when these kinds of policies were put into place exactly how long they would last is a little dodgy also. Remember, at first they were like quarantine for 6 weeks. Quarantine for 8 weeks, quarantine for 2 months.
15 days.
There was.
I guess I'm the cuck. I was okay with 15 days. 15 days was fine. I'm like, sure, 15 days. We can do that.
Robby willing to be a patriot.
Then on day 15, I got my going outdoors cap on, and no, I never wear a hat. That's a lie. We want to get into more research on the impact of school closures. A recent study published by the American Enterprise Institute finds that school closures and online learning have driven a massive decline in enrollment in public schools. Districts that spent more of 2020-2021 in person saw enrollments rebound, while the districts that were remote longer saw more students leave, and enrollment rebounds fell along partisan lines. 2021 to 2022 school year, most districts that voted for Donald Trump rebounded, while enrollment continued to fall in districts that voted for Joe Biden. Masking requirements in schools also made a difference. Districts with the longest running mask requirements saw the largest enrollment declines, with a net loss of roughly 1 in 23 students, which I think is not surprising. But you talk a lot about, and we kind of disagree on this, we quarrel about this, you think there needs to be more funding of the education system and the teachers need to get more money. But this is a recipe for defunding the various schools you want to get more money. If they're doing these policies and they're losing kids, then they're going to have less money to play with because of per pupil funding. So it's going to be like a doom spiral for these schools.
Well, so I would love to know more about where kids are going, because obviously, you have to go to school. So are people homeschooling, or is what people are doing, and I know some folks who've done this, is to move their kid to a different place that had schools open and also had fewer incidents of COVID. So I know a lot of folks who, let's say, went to Vermont, a place with fewer people and it's more spread out, and where schools frankly didn't have to close. There wasn't that same exigency because COVID just wasn't as big of an issue in the state.
Right.
You're not dealing with packed public transportation. You're not dealing with
Ryan Grimm did something along those lines.
I was trying to keep his name out of this.
I think he said it. I think he said it before on the show.
Enough.
Yeah.
Fair enough. And that, so, is that the kind of thing you're going to see where people end up coming back as they either normalize with COVID or COVID levels actually go down? Or are people going to stay in those environments? Or are people homeschooling and deciding that that's what's best for their kids? And, that's an interesting conversation to be had, given there's, discussion about socialization and our kids getting language skills. Well, if people are choosing to homeschool and that's the consequence, people are able to choose their choices. But, I think that it's completely fair if people want to re-enroll in other places. Yeah. If you're able to vote with your feet, go ahead and vote with your feet and find whatever's good for your kids.
Of course it's fair. I'm just saying district officials in schools that are losing people, you have to, parents want their kids in school with, at this point, as minimal restrictions as possible.
Well, to do that, I gotta say, I know you're gonna what you're gonna say. I agree with you. The HVACs, let's get them in there. That's the thing.
Let's get them in there.
HVACs are very effective, and a lot of places in the country are warm enough to keep windows and open and have classes outside. We had teachers that used to have us sit outside for classes just to switch it up and to get us engaged and have things that are new. That happened a lot. I grew up for 6 years in Kenya, and the weather was always good. We often had outdoor instruction. So if you live in California or Texas or Louisiana or parts of the country that have really nice weather all year, I don't see why those kind of interventions shouldn't be ongoing to really help parents in this effort to get their kids' education back on the roll.
Get them back in school, or yes, outdoors when it's nice out. That sounds perfectly fine. All right, we'll have more Rising after this.